Thanks so much for having me. My name is Samantha. I'm with the Office of the National Coordinator for Health Information Technology. And it's just really a pleasure and honor to be here, really a humble honor to be here with all of you who are so passionate, who are out there every day doing this and making this happen. And I will share with you a policy perspective. And I know you all know that this is a policy perspective from someone who sits in an office in the Beltway, so thank you in advance for your patience and understanding. And I am a Fed, so I like having paper, even though I should be advocating for paperless, connected environments, but change is hard, as we all know, so thanks in advance for your understanding. Okay, so telehealth in the era of health delivery system reform. Change is happening across communities and health systems, driven in part by consumers and by shifts in how healthcare is reimbursed or payment reform. It's also happening in positive ways so that individuals like Dave are connected to the people that matter most to them, while they and their care team can be connected to quality health data when and where it's needed. Today, I'll briefly discuss some of the following as it relates to telehealth activities, HHS's delivery system reform and key legislation known as MACRA that is pushing value-based delivery, ONC's efforts to support high-impact telehealth activities, efforts to address interoperability challenges to get Dave all the health information he needs when and where it's needed, consumer-centered telehealth, and a look ahead at the telehealth landscape and some of the evolving federal policies to advance telehealth. So ONC, the high-tech programs overseen by ONC have helped build the nation's health IT capacity. You probably are familiar with these, the regional extension centers, beacon communities, state HIEs, workforce development programs. There's a focus now not just on adoption per se, but on care transformation, on overall system reform, and on health outcome improvement. This is occurring as we experience a shift to value-based care into meaningful use stage 3, focused on health outcomes. ONC formulates the federal government's health IT strategy, and in 2015, we issued the Federal Health IT Strategic Plan, which I'll speak about more soon. The ONC certification program supports the broader health IT ecosystem and helps to provide assurance to purchasers and other users that a system meets certain technological capability, functionality, and security requirements adopted by HHS. More recently, the Secretary of HHS announced goals for the nation's delivery system reform that chart a path forward for better care, smarter spending, and healthier people, focused on moving Medicare to value-based payment. So this slide includes HHS's vision for improving health delivery for delivery system reform. You saw a similar slide yesterday from Dr. Tuxin. HHS's vision for improving health delivery is about better, smarter, healthier. If we find better ways to deliver care, pay providers, and distribute information, we can receive better care, spend our dollars more wisely, and have healthier communities, a healthier economy, and a healthier country. At the heart of delivery system reform is the shift to value-based payment. This involves paying providers based on the quality rather than the quantity of the care they give patients. This shift toward value-based payment will help advance transformation in how health is delivered. It will help to drive person-centered care that supports an individual's whole health, recognizing that most health happens outside the clinical walls in communities where individuals work, live, and play. This shift presents opportunities for telehealth to enable person-centered, connected care across the continuum. All right, so telehealth has the potential to boost the impact of population health management initiatives while improving access and convenience of healthcare delivery. Driven by delivery system reform and successful population health management initiatives, alternative payment models, or APMs, can lead to cost savings and efficiency gains. In Connecting Health and Care for the Nation, a 10-year vision to achieve an interoperable health IT infrastructure, or ONC's 10-year interoperability concept paper that we commonly refer to as the Interoperability Roadmap, ONC describes a vision for how interoperability is necessary for a learning health system in which health information flows seamlessly and is available to the right people at the right place at the right time. The roadmap provides near and long-term goals around solving the interoperability challenges we heard a lot about yesterday, of addressing silos, of aggregating information to analyze it, and of having quality data that can be available in real time across settings without extra effort or burden for providers or consumers. This is, again, enabling Dave to be on vacation and achieving health outcomes. In the roadmap, we explain that this is about all individuals, their families and caregivers and health professionals having access to electronic health information that facilitates informed decision-making, supports coordinated health management, and allows individuals to be active partners in their health and care, improving overall population health. The roadmap describes having an interoperable health IT ecosystem that supports care across the continuum, including behavioral health, social services, and supports human service providers, and sets forth goals with timeframes focused on sending, receiving, finding, and using priority data domains in the near future. It includes telehealth as part of a vision in achieving a learning health system, and also puts forward goals, again, by 2017 to send, find, and use priority data domains, and by 2024 to achieve a learning health system with the person at the center of the system that can continuously improve care, public health, and science through real-time data access. Okay, MACRA. I was in an earlier session and someone provided a great overview of MACRA, so thank you for that. So MACRA, the passage of the Medicare Access and CHIP Reauthorization Act, or MACRA, supports the ongoing transformation of healthcare and delivery by furthering the development of new Medicare payment and delivery models for physicians and other clinicians. Because CMS is currently in proposed rulemaking, I won't comment a lot on this legislation, but I do want to highlight some of the key aspects of MACRA that are all in the public domain. So as many of you know, the law repeals the sustainable growth rate formula for updating the Medicare physician fee schedule payment rates and substitutes a series of specified annual update percentages. It establishes a new methodology that ties the annual physician fee schedule payment adjustments to value through a merit-based incentive payment system, or MIPS. If you don't know what MIPS is, it's a good acronym to get to know, for certain eligible providers, and creates an incentive program to encourage participation by eligible professionals in certain alternative payment models, or APMs, another good acronym to get to know. In recent congressional testimony, CMS indicated how its work will be guided by several critical principles that promote better care for Medicare beneficiaries. Rewarding providers for the outcomes technology helps them achieve with their patients, allowing providers the flexibility to customize health IT to their individual practice needs. Technology must be user-centered and support physicians. Leveling the technology playing field to promote innovation, including for startups and new entrants, by unlocking electronic health information through open application programming interfaces, or APIs, the technology tools that underpin many consumer applications. This way, new apps, analytic tools, and plugins can be easily connected so that data can be securely accessed and directed when and where it's needed in order to support patient care, and prioritizing interoperability by implementing federally recognized national interoperability standards and focusing on real-world uses of technology, like ensuring continuity of care, doing referrals, or finding ways for patients to engage in their own care. So a few words quickly on MACRA and telehealth. MACRA furthers the adoption of telehealth and remote monitoring as part of advanced payment models and clinical practice improvement activities. Though reimbursement via Medicare for telehealth services is not expanded explicitly under MACRA, it recognizes telehealth and remote monitoring as a clinical practice improvement activity, or CIPIA, under the MIPS, again, two more acronyms. Additionally, MACRA clarifies that providers in alternative payment models may provide telehealth services even if the service is not reimbursed under the Medicare fee schedule. So MACRA has potential to be part of that moment is now opportunity that Dr. Tuxen talked about yesterday, and stay tuned. The NPRM should be out soon. It's an opportunity for you all to review and comment. Okay, so here are some of the work ONC's is. So we work closely with CMS to implement MACRA policies and principles. We also support other high-impact telehealth activities and related opportunities that support health transformation, and I'll briefly highlight a few here. Telehealth adoption and interoperability. This includes the integration of telehealth data, including patient-generated health data, with EHR and other technologies, and advancing interoperability to ensure the right information is available at the right time for all health visits, including during telehealth consults and e-visits. Some examples of our activities include the Federal Health IT Strategic Plan that identifies the federal government's health IT priorities and strategies, and includes goals related to telehealth for expanding adoption and use of health IT to include a broader set of technologies such as telehealth and mobile health. Patient-generated health data, or PGHD. ONC is working with Accenture Federal Services to develop a policy framework that identifies best practices, gaps, and opportunities for progress in the collection and use of patient-generated health data for research and care delivery through the year 2024. Expanding access to health and care and helping to improve health equity. As you all know, telehealth offers effective tools for at-risk, underserved, vulnerable populations, including those in rural areas with behavioral health disorders and with disabilities. We support ONC has been very active in the Broadband Opportunity Council for the department. And also want to focus for a moment on telebehavioral health, including substance abuse disorders. So we are seeing an increasing interest among federal and non-federal stakeholders in leveraging telehealth for behavioral health treatment, especially in the face of the growing opioid epidemic. For example, within HHS, AHRQ, the Agency for Healthcare Quality and Research, is making up to $12 million available to fund as many as 4 research demonstration projects to support implementation of medication-assisted treatment, or MAT, for opioid use disorder and rural primary care practices. SAMHSA, or the Substance Abuse Mental Health Services Administration, is also funding MAT through their opioid addiction grantees for MAT, some of which these grantees some are advanced in their use or are considering telehealth. So they're all at different places, but definitely SAMHSA is looking at how they can use telehealth to expand access to MAT through that grant opportunity. And I just want to pause for a second. As you all know, the opioid crisis is really tearing apart communities. To the extent that telehealth can step up and show how it can be effective in helping to address that is an incredible use case to start to share stories on. So those of you that may be interested in exploring telebehavioral health further for MAT, if you could reach out to me, I'd be most grateful to know what you're doing and what your needs are. Furthering telehealth innovation and adoption and support of advanced health and alternative payment models. So last week, ONC held a roundtable on how telehealth practices can support alternative payment models, clinical practice improvement, and connected health across the care continuum. We heard from a range of providers, payers, and consumers on how they're using telehealth to support new clinical processes, and look forward to producing a white paper that will include a lot of the discussion from that roundtable and some of the considerations we heard for federal action going forward. Privacy, security, protections of health information, and usability. So individuals should be able to trust that their health information, such as that generated or collected via home monitoring devices or other emerging technologies, is protected and secure, and the consumer-facing technologies should be usable and accessible for all individuals. So we at ONC are collaborating with federal stakeholders to advance the priority of accessibility and usability in health information technology, systems, and tools to further to move from a compliance-oriented approach toward one that's user-driven, responsive to human-centered consumer experiences, and results in increased patient engagement and improved health and wellness for individuals with disabilities, older adults, and their caregivers. ONC has a Federal Advisory Committee, or FACA, task force on APIs, and that was established this year to identify priority recommendations for ONC that will help enable consumers to leverage API technology to access patient data while ensuring the appropriate level of privacy and security protection, and task force recommendations will be out soon. So, of course, at the core of telehealth opportunities for engagement is the consumer. It's Dave, the individual who's empowered to access and manage his or her health information. And here's just a slide quickly that emphasizes that a learning health system must be person-centered. The person's at the center is the first goal of the Federal Health IT Strategic Plan, and it's included here in the learning health system vision set forth in the Interoperability Roadmap I also mentioned earlier. So, last April, ONC sponsored a design session to inform the challenges, principles, and opportunities for consumer-centered telehealth experience. We basically had a lot of Dave stories that day. And it focused on user experiences without limitation to unleash the full potential for consumers' experience as part of telehealth in the future. So workshop participants identified a lot of design principles for a consumer-centered telehealth experience, and I'm just going to focus on 2 here in the interest of time. So converging data for interactions to be safe and meaningful, number 6. In all of the group's future state designs, data freely flowed from clinical interactions leveraging telehealth solutions back into the patient's core medical record. And number 5, consumers or Dave's the hub of his own healthcare data. Consumers are quarterbacks for their health data. They can ensure that all required stakeholders have access to the information required for safe and cost-effective care. And here are some of the other principles. There's a report that's available online if you want to Google it and read more. Okay, last but not least, policy developments to highlight. Here we go. So, not going to go into all these on reimbursement. Folks have been talking about opportunities through the CMS extended coverage for telemedicine services as part of its next generation accountable care model of payment and care delivery. Then there's a CMS new bundle payment for hip and knee replacement grants that provides more flexibility in the use of telehealth. For evidence, AHRQ issued a draft technical report that found a large volume of research reported that telehealth interventions produce positive results when used for communications, counseling, and monitoring and management for several chronic conditions. And it also called for that research should be integrated into evaluation of new models of care and payment. So stay tuned for, I'm not sure the time frame is for when that would be finalized. Okay. I'm going to go down to ONC in the interest of time. Oh, wait, did I miss one? This? Oh, here we go. Oh, President's budget. Okay, don't want to miss that. So President's budget in 2017, the HHS budget proposes to expand the ability of Medicare Advantage plans to deliver services via telehealth and enable rural health clinics and federally qualified health centers to qualify as original telehealth sites. What's important about this is it's scored on the executive, not the legislative side, but through the OMB as $160 million in cost savings over 10 years. Congress, the bipartisan Senate Finance Chronic Care Working Group released a policy options document in December 2015, and what's worthy to note about this is many of their policy recommendations include telehealth as part of what they're putting forward. And then the PCAST report that was just released includes several explicit recommendations involving telehealth, one of which focuses on improving regulation and payment to reflect innovation in telehealth. Okay, so let me skip down to ONC. So going forward, ONC, we will be supporting implementation of the Federal Health IT Strategic Plan, the Interoperability Roadmap. We're also developing a federal compendium, a compendium of federal telehealth program activities. So we recognize that there are many federal players invested in the telehealth space, from FCC to FTC to CMS, to SAMHSA, to VA and DoD that are doing this. The Indian Health Services has a Center for Telebehavioral Health Excellence, NASA, Justice, Bureau of Prisons, FDA, the DEA. I was at a hearing last year on the House side, and someone, one of the members said, it's a federal alphabet soup of everyone that's interested in telehealth. So there are many players, and we want to just try to help. As coordinators, we think that we can help describe some of those activities, capture the scope of federal activities and interest in a user-friendly format through this compendium. We're also developing the white paper from our roundtable that I talked about. And again, we're really looking at advancing telehealth as part of the health IT infrastructure and as part of delivery system reform overall, and furthering our role as federal coordinators. Here are just some of the activities of interest that I wanted to highlight for you. Not at all, this isn't comprehensive, but the Tech Lab consists of our new approach for how we're going to organize our standards and technology work. The Interoperability Proving Ground provides an open community platform on a diverse array of interoperability projects. Check it out, sign up, showcase your community. State Policy Lovers Compendium is an online resource that supports state effort to advance interoperability. And in future versions, we hope to include more on state activities and resources around telehealth. A model privacy notice is out for comment. The app challenge was mentioned yesterday. It really looks at aggregating data to develop consumer and provider apps using open APIs. And the API Security Task Force I mentioned earlier. There was also another request for information that was released on assessing interoperability for MACRA. And ONC seeks comment on a number of questions related to interoperability in MACRA, including whether or not the focus of measurement should be limited to the use of certified EHR technology. So in closing, just a few quick 3 items to recap. Make a concerted effort to seize the policy opportunities and comment on the MACRA NPRM and some of these RFIs that are out. Share success stories of interoperability as it includes telehealth technologies and enabled services, and leverage our platform to showcase that. And keep the consumer at the center and ensure telehealth works for all consumers, making it accessible and usable by and for all. Thanks so much.